Nursing Staff Strategy Business Case. This business case is the project set forth for a graduate course in ISC555. This business proposal is to talk about a nursing staffing strategy database that will allow the capture of admissions and discharges and their time intervals in between these two activities. This would give us a better prediction of times of high volume and patient turnover. The fluctuation of patients in and out of the clinical unit places an increased workload on the staff members. For every patient that enters into a work area or a clinical area adds 3.5 more patient care hours to that area. The goal of the database is to enable the nurse manager to capture these trends and have the ability to produce that on a dashboard that we can readily use on a daily, weekly, monthly basis. The nursing staffing strategy tool will also be used to guide staffing patterns to provide adequate staff for those quality measures. It will identify patients with higher risk for readmission. This will allow the care provider to provide education that is patient-specific during their stay and also at the time of discharge. That will help us to prevent the likelihood of an early readmission. By putting these pieces together and being able to capture this data and being able to plan ahead would actually help with the level of productivity, the delivery of quality care, which will increase those quality measure scores, and it's also a very safe practice for patients and for nurse satisfaction. The business need is because the increase in patient volume over the last fiscal year and the organizational focus on patient throughput, the patient care standards, and the quality measures that has produced multiple admissions and discharges of patients occurring simultaneously in a short interval of time between them. The ability to control these patients' movement in and through our organization will give us a better fit. Right now, the adverse impact of not having those control buttons is that the admission and discharge of patient requirements are unpredictable and they're time consuming. The increase of the patient care hours are difficult to capture. Inadequate nursing staff available during these times of high turnover. And the increase in the nurse's workload, which causes stress and anxiety and eventually burnout. With the nurses looking for other places to work because of the stress and anxiety and the burnout, will place a higher cost on the hospital or the organization for nursing replacement. The ability of the clinical nurse to give appropriate care to the new patient arriving and the patient being discharged from the unit is their biggest dilemma, and it also that is part of that anxiety because our dedication is to that patient that we have already been taking care of, and we know that they're going home, and we want to prepare them to the best of our ability to do that. And then we also know at the same time we're receiving a patient from the emergency department that we need to put our eyes on and do our assessment so we can get rapid care to that patient. Because sometimes it does mean it's a matter of life and death, and making sure that we are getting those orders processed in a timely manner. So all of these things put together will increase. If we don't have time to do this, it does put a high risk for medication errors, mortality rate, more sentinel events, and also an increase in the readmission rate for those patients that are at high risk. This is inefficient, it's a high cost, and it's also an inadequate care delivery system. The benefit of the NSSR tool will give the organization the ability to capture patients' admission and discharge on an hourly, daily, weekly, monthly basis, and it's in a dashboard that we're able to read and utilize at the time. It will allow us to track and trend these out to better justify our FTEs throughout the year. And it will also give us ability to track the available beds and to allow placement for those patients to be in the right beds. It will give us the ability to increase patient, it will give us the ability to plan, for increased patient volume and ensure adequate staff are available. The goals and objectives of the NSSR tool is to have an efficient quality care delivery system put into place, and by having control of patients moving in and out of our units, having adequate time to spend with that patient that is going home, and doing the education and the discharge planning for that individual patient is pertinent to their care and how they will do after they leave our building. But it's also as important for that patient that we are receiving back into the unit that we're able to get in there in a timely manner and to process those orders, or to make sure that that patient is moved to a higher level of care if he needs to go to the unit. By doing these things and having that information, we give the nurses the ability to take care of our patients that are coming in. It reduces the readmission rate of those chronically ill patients, gives us better the ability to better plan. We have a quicker response time to those acutely ill patients, and it eliminates the delay in care. It decreases medical errors, the mortality rate, and also sentinel events. It improves nurses and patient satisfaction, and it reduces nursing staff turnover. Meaningful questions that the NSSR tool would answer for us is: how many admissions and discharge occur in a day, week, month, or a year? By answering this question, trends can be viewed easily from a dashboard, allowing the nurse manager to predict increased unit activity and patient volume, and to build better staffing models that is conducive to providing quality care, and to use that model for efficient budgetary planning. 2 is what the time frame between admissions and discharges are that are arriving to the unit. Answering this question will give valid data to address correct bed utilization, time management of unit activity, and appropriate patient care hour ratio for patient safety and staff satisfaction. By controlling the activity level of admissions and discharges on a clinical unit, it will produce better outcomes for patients, increase the nurses' satisfaction, thereby reducing nursing staff turnover. The last 2, who are the patients with high readmission risk scores, and how many patients are admitted with a risk score greater than 75. By answering these 2 questions, the information would allow for better patient planning for discharge, education, and instruction. It will also be used for reducing the readmission rate. It will help the organization to adopt accountable care models, and it will help to better plan and determine educational needs, and also provide for outpatient services that that patient may need at the time of discharge. By putting all of these pieces together, this tool is very simple. We have all of the information already available. We just need to bring it together in one format to be used. So this ends the first part of this presentation. The second part will be giving demonstration, and Shweta will be bringing that to you. Thank you very much.
I'm Shweta Purawat. I'll demonstrate meaningful use of our NSSR tool by discussing the reports generated by our tool. The first slide shows trends of admissions on monthly basis. By our tool, we can capture trends of admission and discharge on daily, weekly, monthly, and yearly basis. I'll show you number of admissions in year 2012 in our hospital on monthly basis, and also in month of December how many admissions were there on daily basis. First, let's discuss number of admissions in entire 2012 year. In October, number of admissions were 8. In November, number of admissions were 10, and in December, number of admissions were 38. This report will guide our manager to do adequate staffing, which will result in quality care to patients, staff satisfaction, reduce workload, and stress on nursing staff. Our tool have a capability to generate report in bar chart form. You'll see the same report in chart format in the next slide. As you see here, the y-axis shows number of admissions and the x-axis shows month of the year. You can see in October the number of admissions were less than number of admissions in November, and in December number of admissions were far more than in month of October and November. The total number of admissions in December were between 35 to 40. This can easily this will help nursing manager to easily view the reports and see the trends, as the chart format is much easier to understand than a list format. In the next slide shows the daily trend in the month of December. As you can see, the dates are, the day of the month is on x-axis and number of admissions are on the y-axis. In month of December, on 1st of December, number of admissions were 5. On 2nd, the number of admissions were 7. And likewise, you can see according to the date. On 26th of December, the number of admissions were around 8. So this gives nursing manager how is the trend on daily basis. Now coming to second meaningful report that is generated by our tool, that is time frame between admissions arriving to a unit. As you can see, the chart shows number of admissions on hourly basis on 25th of October 2012. We can see between 9 a.m. to 10 a.m. there were 3 admissions. From 10 a.m. to 11 a.m. again there were 3 admissions, and between 11 a.m. to 12 p.m. there were 2 admissions. So during the entire day, the 9 a.m. to 12 p.m. shift was the most busy. This report will help nursing manager to adequately plan the nursing staff during the busy hours. Just for the information of the viewers, we are generating the reports based on dummy data. If actual hospital data is given to our tool, our reports will be much more realistic. Similarly, we can generate reports for discharges in a unit. This report captures time frame between discharges in a unit on 16th of November 2012. As we can see, there were 8 number of discharges during 9 a.m. to 10 a.m. time frame. If the nursing staff is not adequate to handle this number of discharges, this can directly impact the care that is given to patients during discharge, which can result into number of readmissions. This can also stress out the nursing staff during the peak hours. Hence, it's very important to know the trends on weekly monthly, yearly basis to adequately plan the nursing staff. Our third and fourth report help to manage readmissions. The solution identifies patient with high risk scores. Higher the risk score, higher are the chances of readmission. As you can see in the report, the last column gives the information of readmission risk scores. The report lists number of patients with risk greater than 75%, which indicate the patients who are at high risk of readmission. The report gives the patient ID, first name and last name of the patient, gender, age, race, and the readmission risk scores. With the help of this report, hospital can reduce readmissions, adopt accountable care model, target patient interventions, avoid CMS penalties. Our fourth report will give proof of the concept that all the readmitted patients have higher risk scores. The first report shows the patients who were readmitted. The first column shows the patient ID and the second column shows number of readmissions for that particular patient ID. So there were 6 patients who were readmitted in the hospital. Let's see their risk scores. The second part of the report shows patient ID, number of readmissions, and corresponding readmission risk scores. As you can see, readmission scores for the readmitted patients were greater than 75%. These are the readmissions that can be managed by the hospital. The report also gives the information about the departments where the patients were readmitted. The hospital management can look into the factors that are causing the readmissions and take proper steps to reduce the readmissions, either by adequately planning the staff or improving the quality of care given to the patients. So we have discussed all the reports. Now, just for the information, I'll again repeat that we have used dummy data to demonstrate our system. The system will give much more realistic reports on the actual data. Thank you.